everyone. I hope that you can hear me well. So I'm Jean-Philippe Arier, for those who don't know me. I am working at Lux Innovation, the National Agency for Innovation, and I have the pleasure today to moderate this session that will be dedicated to understanding how this Joint Call HealthTech will work this year. And for this, we will have the very best persons to really answer your questions, as they are the people who worked the most in defining this new call that we have. So we will have, of course, the people from the Ministry of the Economy with Carol Breutler, people from the FNR, so Gideon and Andrea Monat, and people from Lux Innovation, Maximilian and Anne. And so I'm really happy and proud to have this new call out. I think it's very important, as many of you know, innovation is always and it's a matter of connection, of working together, collaboration. And so that's exactly the goal of this PPP, is to put together people to really achieve some new research steps together. And so, of course, we will have today to understand and to have an overall understanding of how this call works. So I will directly let the floor to Carol Breutler from the Ministry of the Economy to have an introduction of why this call is out and why it's so important for the Ministry of the Economy. Carol?
Good afternoon, everyone. Glad to have you in so high numbers. From the Ministry of Economy, we're delighted that we are able to launch a second call in the joint call in the health tech sector. As you know, the health tech sector is one of our priority sector development. The ones of you that are on the company side know we found in the first joint call such great interest to participate, and I leave the team introduce the specifics of what will stay the same and what we are evolving. But for the ones of you that don't normally listen to the Ministry of Economy in a direct interaction, just maybe to reiterate why we think health tech is so important. So in the diversification strategy of the government, we have a number of economic sectors that we actively support by encouraging collaborations, fostering innovation, co-financing it. And health tech is one of those. We also have in parallel the work ongoing to digitalize our industries and our ways of working. So the digitalization and the health tech is where these three strategic work streams come together, and that's why the theme for the health tech joint call is in the digital devices, medical devices, and digital health. In a big ambitions for the sector. So we are, for example, launching as a mid and long-term project the HEAL campus, to the health and innovation campus near Belval, near the House of Biohealth, next to the university and of the LIH facilities and near all the major public research institutes of Luxembourg. So this will fundamentally shape and evolve how the collaboration in the health tech sector works. None of these things happen from one day to the next, but as we are interacting more and working together more, these things will naturally find their place. We also have other projects for the ecosystem. For example, improving the access to private financing to complement what we as a Ministry of Economy can do, also with public partners like the FNR, and also maybe on the mid to long term, how the reimbursement of the medical device helping to co-finance in this call can be made Luxembourg, but also importantly the access to the knowledge how to do it in other countries. So this is all part of a grand ambition, and this is another milestone to advance it. And I look forward to hearing if this helps advance the ecosystem. So thank you very much for joining us today, and looking forward to developing it together.
Thank you very much, Carol, for these kind words. And now I will let the floor to Andrea Monat from the Fonds National de Recherche. Andrea?
Yeah, you hear me, right? So welcome everyone from my side as well, and thank you for joining us here today. As Carol mentioned already, last year we were proud to launch our first Joint Call in HealthTech, and the result was a fantastic pool of projects submitted, and we announced that half of those were funded. So success rate is really high, which is very good for you. And the second Joint Call will not only provide a financial but the aim is also to help bring research to the forefront and make it more visible to a wider audience. The focus on collaboration between companies, research, and healthcare organizations will help create a stronger ecosystem. We hope that each actor can contribute with their expertise and resources towards a common goal and leverage each other and also our other research funding programs in this domain. We also encourage consortia to align with national research priorities, such as the development of personalized medicine and the creation of data innovation service platforms. And my colleagues will go in a second more details into that. And lastly, I would really like to encourage all of you who are interested in this call to come forward and submit your projects. And we all here believe that collaboration is key to success. And we are all, of course, eager to see the impact that our funding can have on the development of innovative digital solutions, but ultimately on our society. So with that said, thank you very much. I wish you a great session, and I'm happy to give the word to the next speaker. Thank you.
Yeah, thank you very much, Andrea. Collaboration. So it started together, FNR, Lux Innovation, and the Ministry of the Economy. And so we will have something new this year. Just maybe to talk about this webinar today, two words. First, it will be recorded so that in case you want to go back to this session, of course, you will receive a link in order to have access to the video of today. And after the presentation today, you will have a Q&A question, so that you will Q&A session, so you will be able to ask as many questions as you need to the speakers of today. Nothing else to add. Maybe we go now into the details with Anne Meunier, who will present the scope of this PPP call.
Thank you, Jean-Philippe. Good afternoon, everyone. So yes, today I'm going to talk about the scope of the Joint Call HealthTech. But before, I just wanted to go back to the objective of the call. The big enthusiasm that was after the first edition, the first goal of this joint call is actually to develop further the culture of collaboration between players in the ecosystem. And we believe this is particularly relevant for the health tech sector. And we would like to foster partnership between companies, public research, hospitals, and care organizations for them to work together and develop innovative solutions. So the second objective here is to provide a financial support to both public and private partners. And obviously, the third objective is to help them develop innovative solutions. And this can be done only by the combination of technical, research, clinical, and healthcare expertise. And this is particularly crucial for them, so they can develop health solutions that is fully relevant to answer specific needs and benefit the healthcare ecosystem. And finally, the last objective I want to mention here is this joint call is also the opportunity to raise awareness about the digital tools for the healthcare professional and the patient, and ultimately to facilitate the adoption of such tool in the healthcare ecosystem. So now on the next slide, I will speak about the scope of the joint call. So once again, as Carol already mentioned, the joint call is fully aligned with the National Data-Driven Innovation Strategy of the Ministry of the Economy and of the strategy for the health tech sector development, which is focused on digital health company. And notably, this joint call is a tool to help them to go one step forward on the market access. So in short, the scope is the development and validation of innovative digital health solutions benefiting the national healthcare ecosystem. So before going into details, I want to to explain a bit what benefit for the national ecosystem means and how we can translate that in terms of technology. So a technology that will benefit the national ecosystem can include, for example, tools that will allow to improve prevention, diagnosis, monitoring, or treatment of health condition. So overall, to improve the public health. It can also include technologies that will improve care delivery. So, for example, facilitating the communication between healthcare providers, between healthcare provider and patients, and facilitating and ensuring a better care for patients. And the last point is actually a new specificity of this second edition of the call, is technologies that will allow to improve patient autonomy at home or in home care environment. Now, on this slide, I want to come back to discuss about some specific requirements for the project. So as it's mentioned in the call text, the project must aim at co-developing and validating digital health solutions at the clinical level in order to demonstrate their relevance and benefit for the human health and our society. So there are many important words in this sentence. I will try to explain all of them so you can better understand what which project can fit or cannot fit in the scope. So first, digital health technologies. So the scope of digital health can include mobile health, telemonitoring, medical software, and technologies such as artificial intelligence, and machine learning. And obviously, this technology can be applied to many applications, but here in this call, we want to focus on two main categories. So the first one will be medical products that are or will be regulated by European regulation for medical devices and in vitro diagnostic medical devices. And the second is the use of innovative data processing and analysis techniques on real-world data from healthcare and care environment to prove a beneficial impact for the society or from an economic point of view. So another important word here you can see is the clinical level, so the clinical validation of this technology. So this is important to mention that to validate the technology must be at least at prototype stage. So it's possible to have a technological improvement during the project, but it's really important for you to have a working technologies and that can be tested during the project in a clinical setting. And finally, just to go back on one of the objectives, I was mentioning earlier that the idea is to bring the technology closer to market. So here you can see the 3 milestones that can be reached in the project. And actually, this milestone are the different steps that will allow you to bring your technology closer to the market. So the first one, it's evidence of safety and performance. So the projects that will try to reach this goal actually should focus on the acquisition of clinical data with the technology to get information regarding the usability of the technology. So in other words, this means that the goal is to understand how the technology behaves in the hand of the doctor or the patient, and to verify that the technology is well suited for the goal for its purpose. The second step is evidence of effectiveness. So in that, yes, the project should focus on the acquisition of clinical data to test the technology once again in real life, but now to demonstrate the technical performance of the technology. So for example, it can be accuracy or sensitivity of diagnosis tools, or earlier diagnosis, or this kind of thing. And actually, this step will allow you to get some data which will be mandatory for the CE marking process. The last step, which is actually the focus, the project that will try to reach the step 3 should focus on the acquisition of data that will demonstrate the benefit of the technology from an economic and societal point of view. So here, the goal would be to show the added value for the patient, for the doctor, or for the hospital in general, and For example, the technology will allow you to save time to treat more patients with the same resources, or to reduce the cost for specific treatment. And the data obtained in this step are actually crucial to get reimbursement from Social Security. So an important thing to mention here also is that it's not mandatory at the end of the project to be able to commercialize the technology, but you must have a clear roadmap of the next step after the project. And finally, on the next slide, I wanted to discuss the setup of the consortium, which is also important for this collaborative project. So the main criteria actually is it's mandatory to have at least one eligible company to the funding from the Ministry of the Economy, and one organization eligible to the funding from the FNR. So this doesn't mean that I want also to go to, no, sorry. Maximilian and Gideon will explain a bit more about the eligibility criteria of the Ministry of the Economy and the FNR. But here I also wanted to add that international partners and national partners that are not eligible can also participate, but they need to have their own funding. And finally, last thing, we expect the public partner and private partner to have almost equal contribution, and at least no party should bear more than 70% of the project cost. So that's all for me, and now I will leave it to Max, who will talk about the eligibility criteria for companies.
Yeah, maybe I will add a sentence shortly. So just to remind that on the top right of your screen, you get a tab that is dedicated to write down your questions. So do not hesitate to type your questions on that part so that we can take at the very end of the webinar of today all the questions. Maybe a second thing, we have seen that some of you are experiencing some lags. Sorry for that. So the technicians are currently working on it. A suggestion for the technical team is really to use either Chrome, Google Chrome, or Firefox. Personally, I'm using Firefox. It's working very well. So I don't know if you can fix it by switching your browser. Okay, so Max, it's to you now to present all the eligibility criteria part.
Thank you very much, Jean-Philippe, and yeah, good afternoon, everyone. So indeed, I will now start and present you the more general eligibility criteria that the interested companies would need to fulfill within this second edition of the Joint Call HealthTech. And as for the other joint calls that we organized jointly with the colleagues from the Ministry of the Economy, the FNR, and Lux Innovation, these criteria for the companies are also aligned with the Ministry's standards R&D aid schemes, which some of you might already know quite well from other aid applications. So first of all, very important to note that only private companies that are already registered here in Luxembourg are eligible for direct funding by the Ministry of the Economy. Otherwise, if you're interested in this Joint Call HealthTech, but you're not yet here in Luxembourg, you should, in that case, register a company or Luxembourgish entity before the start of the second phase, so by May 2023. In addition, the companies also need to demonstrate their viability and financial soundness regarding their contribution to the project, and they should also demonstrate that the expected outcomes of this project will have a positive impact on the future of the company. On the other hand, a company would not be eligible within this call if it must be considered as an undertaking in difficulty. So to verify this criterion, we would double check some financial figures and ratios based on your company's annual accounts. And more precisely, so an undertaking would be considered as being in difficulty if it has lost more than half of its subscribed share capital due to accumulated losses. So as I said, in that case, the company would unfortunately not be eligible within this call unless it has already initiated some measures to get out of this situation. So for instance, by means of a recapitalization of the company actions. And maybe last but not least, so important to say here as well that startups, so companies that are younger than 3 years, they do not fall under this criterion of the undertaking in difficulty. And with that, I would already give the floor to the next speaker, so to Gideon Giesemann from the FNR, who will also be happy to give you more information about the eligibility criteria for the research organizations.
Thank you, Max. And also good afternoon from my side. As Max already mentioned, I'm going to tell you something about the eligibility criteria for the public research organizations. So in general, a research organization to receive funding from the FNR must be eligible and registered at the FNR. This means that we are either talking about a public institution that is performing research in Luxembourg or an entity that is that is engaged in research and is either a nonprofit association, a societal impact company, or a foundation. But all those must be accredited by the Ministry of Higher Education and Research. And here it is important to keep in mind that this accreditation status is timely restricted, so it requires regular renewal. What I also wanted to mention here is that the PI of the research institution that is part of the project needs to have a employment contract that is at least valid for the full duration of the project. And the last point on this slide is that what is important, and especially for the research institutions as well for the companies, is that there is a consortium agreement in place, so that legal issues that may arise, like what covers the IP rights, needs to be addressed. And if you have any further questions or need some insights into the guidelines, please refer to the guidelines for the funding scheme FNR Bridges. Okay, Max, you can, yeah, thanks you. Okay, so now some words about the funding conditions. The FNR funds the research organization with a maximum amount of 500,000 euro in this year's edition of the call. We are able to fund up to 100% of all eligible costs. And if you need to see what the eligible costs are, please refer to the FNR financial guidelines. And something special for this year's call is that the Directorate of Health has an option to allocate additional 50,000 euro for a project where a hospital is involved that is conducting clinical research. And this 50,000 euro then adds up to the 500,000 euro from the FNR. And in general, the whole duration of a project can be between 24 and 30 months, with including 6 months of elongation that you can request if necessary. And yeah, I think I can now hand on to Max. Thank you.
Thank you, Gideon. So indeed, to also complement for the companies about the funding conditions, so they are before aligned with the national RDI law of 2017. However, what is quite interesting and specific within this Joint Call HealthTech is that the Ministry of the Economy also has the possibility to give an upfront payment of 35% to the interested companies upon request and upon justification of their liquidity needs. In addition, the maximum funding amount from the Ministry of the Economy would be 700,000 euros per project. And here it's really important to say that this maximum grant of 700,000 euros is really per project and not per company. So to give you an example, if we would have a consortium set up of one research organization and 2 companies, then these 2 companies would need to share the maximum aid amount from the ministry, depending on their respective project costs. And finally, the maximum aid intensity for this call would then be up to 60% of the eligible costs, depending on the actual size of the company, meaning that a small-sized company could get up to 60%, a medium-sized company up to 50%, and a large company could still also get up to 40% of co-funding from the Ministry of the Economy. So on this slide, I would now like to give you some more information about the specific submission and evaluation process with the second edition of the Joint Call HealthTech. So the general procedure is actually aligned with the previous joint calls that we organized together with these three parties, meaning that there will be two main phases within this call. So as all of you know, the first phase of the call starts today on the 1st of February. And here the first phase is really about the preparation and submission of a short project outline. So this project outline, you would need to prepare jointly with all your consortium partners on the research industry collaboration platform. And here the submission deadline would be in roughly 2 months, so on the 31st of March of this year. But I will of course also give you a couple of more details on the different phases on the following slides. So what will happen after the submission of this project outline? There will indeed be an evaluation of the project outlines by the two granting authorities. And in addition, Lux Innovation will also do the eligibility and financial viability check of the companies. Based on these different reviews, there will then be a go or no-go decision per project, meaning that unfortunately some projects will not be retained for phase 2, while others will be pre-selected for phase 2 and potentially also with some recommendations. So the communication of these feedbacks and results of phase 1 will probably be done either end of April or beginning of May. Afterwards, there will then, as of the 15th of May, be the second phase of this joint call, where it's all about the preparation of a full project proposal. And what has really changed compared to the first pilot edition of the HealthTech call that we had 2 years ago is that this time there will be only one common template, so one single template for the full project proposal that you will need to fill in jointly with all your consortium partners, all your collaboration partners. And this full project proposal, together with some confidential annexes, would then need to be submitted for the companies directly to the Ministry of the Economy via the MyGishi platform. And likewise, the research institutes, they would need to submit their aid application directly to the colleagues from the FNR via the usual grant management system. And as you can see on the slide, the final submission deadline would then be on the 14th of July, so just before the summer holiday. After submitting this full project proposal, there will then of course also be an evaluation. This evaluation will then be done by an independent expert panel, which will review all the projects from a scientific, technical, but also economic point of view. And this panel will indeed be coordinated by the FNR, and it will provide a recommendation on all the projects that should receive funding from both granting authorities. What is special is that in the case of companies, their projects would then also need to undergo an additional consultation at the State Aid Commission, and the final decision about the company grant will then also be subject to a positive evaluation by this commission. And as you or as some of you might remember from the previous joint calls, there will then at the very end of this evaluation process be a joint funding decision together by the FNR and the Ministry of the Economy, and only projects that have received a positive decision by both granting authorities will be funded in the end. But I already talked a lot about the second phase, but of course there will also be a dedicated information session at the beginning of this second phase to really give all the details about this full project proposal, the other required attachments, and also, of course, the submission and evaluation process. So on the next slide, so on this slide, you can then also see a more graphical illustration of the call timeline that I just presented. So with the submission of a short project outline during phase 1, the submission of a more detailed full project proposal during phase 2, so with the deadline on the 14th of July, but maybe more interesting also about the timing of the evaluation process. So as you can see here on the slide, the independent expert panel will probably come together after the summer holidays, so in September. And the Ministry State Aid Commission would then take place as of December 2023. Based on this evaluation procedure, the final funding decision of both granting authorities would then be expected for early next year so that your projects can start maybe as of February 2024. Good. So maybe also a couple of words about the submission and evaluation process within phase one. So there will indeed, as I said, be a pre-selection, meaning that there are some specific criteria on which you should pay particular attention. So in this regard, it's really important that your projects are in line with the call topic, that your objectives of your projects are also in line with the call objectives, and as usual, that the documentation about the company, about the research institute, but also about the project itself is really complete. And as I said previously, we will then, of course, also for the companies, go a little bit into more detail and also verify their general eligibility to state aids and their specific co-funding capacity. With regards to the mandatory documents and the project outline that you should prepare jointly with your partners until the deadline on the 31st of March, well, there will be an online questionnaire or an online template for this project outline, which you can directly fill in on the Research Industry Collaboration platform. So this template is a rather short document where you should especially describe your project. So what will it be about? What will be the outcomes that you hope to generate? Who will be doing what actually also doing this project? And in addition, you should also provide a cost estimation for all the partners. In addition, the different partners, so really both the companies, but also the research organizations, they should also provide a CV of their main investigators. But here, during the first phase of the call, it's not important or asked that you provide a detailed CV per PI or per main investigator. It's really sufficient in this case to just share the link to either your ORCID ID or LinkedIn profile. So as you can see, the documentation that is required from the research institute is quite short during this first phase. On the other hand, for the companies, there will be 3 additional attachments that you would need to provide. So there's first of all the organigram of the company, so the applicant company and the group that it might be part of that you would need to submit. Here, it's really important that this organizational chart is really complete, meaning that it provides full visibility on the shareholder structure of your company and really goes up to the ultimate beneficial owner of that company. In addition, you would also need to submit the 2021 and 2022 annual accounts of both, again, the applicant company and the group that you might be part of. And here I would really like to underline the importance of providing at least a draft of the 2022 accounts, because the financial checks that I mentioned previously, they can only be done with the most recent financial information, of course. And last but not least, the third mandatory attachment that the companies would need to prepare is a cash flow forecast. So here it's really about providing more information on your financial projections. It's about demonstrating your co-financing capacity as well. And therefore, we will request also a cash flow forecast. So in the case of startups, you should also provide a more detailed version of this cash flow. And if you are already a more established SME of also maybe a large sized company, in that case, it will also be sufficient to just provide a simplified version of that document. And as we also did it for the previous joint calls, you can also find on the platform 2 templates. So one template for the detailed cash flow, one for the simplified one. If you go into the project outline and there into the attachment section. But if you don't find it directly, you can of course also send us an email and we will be happy to share these documents with you. So maybe just a few words as well about the timeline of the second phase of the call. So as I said, the phase 2 will start on the 15th of May And then you will have about 2 months to prepare and submit your full project proposal. So until the 14th of July, either to the Ministry of the Economy or the FNR. Afterwards, there will then be this review by the independent expert panel, which will provide the recommendation about that should receive funding. And there will then also be the ministry's state aid commission taking place in December, probably. So all of this leading to the timeline that the projects will probably receive the final decision in early 2024 with a project start as of February next year. So on this slide, you can then also see the evaluation criteria for the second phase of the call. So as I said before, this panel will really evaluate all the projects based on these three main criteria. So it's about a scientific, a technical, but also an economic aspect that will be verified by them. And no worries, I will not go into detail for all of the criteria. And find all the details, the complete list of the criteria also directly on the call platform, so in the call text. Maybe just in a nutshell, so the panel will actually have a look, first of all, at the relevance of your project, meaning is there high quality in your project? Is there an innovative character also within your project? In addition, they will also have a look at the implementation plan, so the quality and efficiency of your project plan will also be analyzed. And last but not least, they will also check whether your project will really have a positive impact on both the consortium partners, but also on society as a whole. But as I said, and as Jean-Philippe also mentioned before, there will be a dedicated info session at the beginning of the second phase to really go into more detail about all these relevant things for the second phase. So now that you should know much more about the overall scope and also the procedure of this second edition of the Joint Call HealthTech, let me just also give you a few more insights about the support that we here at Lux Innovation can offer to the interested companies within this call. And afterwards, I will also just give you very briefly 2 or 3 tips and tricks about the usage of this research industry collaboration platform. So as some of you might remember from the previous joint calls, we are actually there to really help all the interested companies during both phases of the call, meaning that during phase 1, we will actually be there to raise awareness on the eligibility and financial viability checks. And we will be happy to also help you complete your application file on the platform. This will actually be done during 3 Q&A sessions that I will also detail a little bit more on the following slide. But maybe also interesting to say a few words about our support during the second phase, because here we will also go into more detail with regards to reviewing even your project. So your full project proposals, your aid applications, and there we will also challenge your project on some aspects. So for instance, we will have a look at the innovative nature of your projects, your business model and exploitation plan, but also, as I mentioned before, your co-financing capacity to cover the project costs that you expect to have. And finally, we are of course also there to support you in some other areas if you need any support. So Gideon already mentioned the IP that should be detailed within the draft collaboration agreement. There we will be also happy to assist you. Likewise, also for the building of some relationships with some potential partners, for instance, or also the documentation of your financial means within this project. So, and as I promised, on this slide, you can now see the dates and the topics of the 3 Q&A sessions that we will organize within this first phase of the call. And although these sessions are mainly focused on the interested companies, all the interested research organizations are of course also more than welcome to join us during these Q&A sessions. And at the end of each webinar, there will then also be a dedicated Q&A part where all of you, no matter whether you're a research organization or company, can ask all your relevant questions. And together with the colleagues from the Ministry of the Economy and the FNR, we will then also be more than happy to answer them as good as we can. So for these Q&A sessions, we will start in 3 weeks. So on the 21st of February, with a first session where we will explain in more detail the eligibility criteria that have been briefly introduced also today. And here we will also provide you more details on the eligible project costs and also how you should estimate them in comparison to your co-funding capacity. 2 weeks afterwards, we will then also go into more detail about the co-funding capacity of the companies. So here it's really about helping you to prepare the relevant financial documentation. For instance, the cash flow forecast. What should you prepare? What information should you include into this cash flow forecast? So on the 7th of March, it's all about the financials. And last but not least, on the 21st of March, so roughly a week or 10 days before the final submission deadline of phase 1, there will then also be a completeness check of your application. Here, we will really provide you more details again about the required attachments, about the submission process, and there will of course also be a final Q&A session to answer all your questions. And maybe just one thing, as Jean-Philippe also mentioned, all these webinars, they will be recorded, and the replays together with the presentation slides will be made available directly on the platform, on the first page of that platform, so that you can also download these slides, have another look at the replays of the webinars. And on this platform, we will also regularly update the FAQ section with the most relevant questions that we received either during these webinars or also by email, so that all of you have really access to the same relevant information. And yeah, so I mentioned the platform quite often today, so maybe just a few things also about the research industry collaboration platform, because it's really the main tool, especially within this first phase of the call. So I guess that most of you might already know this platform from the previous joint calls, but for maybe the new joiners for this HealthTech call, here on the platform, you can really find all the relevant news, the relevant information about the different calls. And as I just said, you can also find here the replays and the presentation slides if you have any further information need. So therefore, I would also really invite you to, first of all, register yourself on that platform and to also create your own account there, because this own account is really the first step before you can then also create your project outline, so your project application for the first phase, and it will also allow you to participate in the matchmaking section on the platform. So on the next slide, you will see that if you select on the top of the website this Joint Call HealthTech 2023, there you will not only find the official call text with all the information that we presented today, but there you will also on the right-hand side be able to have a look at the project ideas that some others have already published on the website. You will also have the possibility to publish your own project ideas and to maybe find some new partners for your project. And maybe the most interesting part is about the project creation. So if you go down on the right-hand side, there you can also create your project outline for phase 1 and start working together with your partners on the project application. And with that said, I would like to thank you all for your attention, and I think that we can now also move on to the final Q&A part of today's webinar. Thank you very much.
Thank you. It was rather clear, but I'm sure that there are still some questions to take. So we have received a lot already in the question tab that we have on the right, on the top right of your screen. And so maybe one thing that I have noted during this webinar is that there are some new things if we compare with the previous PPP call. But maybe the most important one, what we can submit before summer, so before the summer break, so that we can really appreciate the holidays is something new, and thank you for this improvement. Some questions that we have from the audience, and thank you very much for the lot of questions that we have received. I think the questions are very relevant. Thank you for this. Maybe a very easy one. A question from Patrick. All the 3 steps are mandatory to fulfill the project. So he was talking about these 3 steps, step 1, 2, 3 in the code. Maybe Anne, you can take that one.
Yeah, sure. Yeah, thanks for the question. Actually, no, the three steps are not mandatory. You need to focus on at least one of them. So a project can include, for example, step 1 and step 2. But yeah, it's not mandatory to reach the third one at the end of the project.
Very clear. If someone on the speakers they want to add something, do not hesitate. A question that I think it's very tricky from Roger. Maybe it's a question for Carole. So the question is that maybe so Roger understood that in the project we can have some research work to achieve. So what's your interpretation on this, Carole? Are you muted, Carole?
Hi. Roger. The Joint Call 8 scheme has the objective of advancing prototypes to the end. That means from the Ministry of Economy side, we will give aid under the Développement Expérimental. That's a mid-range at risk stage. If your project is mixed, pure R&D and more development R&D, then you a better financial for the Ministry of Economy if you do the research separately first, because that could be classified depending on exactly what the nature is as recherche industrielle, which, as you know, is a little bit higher rewarded because it's riskier for the company. So this is a judgment call. You'll have to discuss that. I recommend that you discuss some Lux Innovation and see from what in your situation is the best balance of getting started versus being part of the joint call, and what's at the most advantage, the network versus the financial contribution from the Ministry of Economy.
Mark, okay on this? Do you want to complement or clear? Okay, it's clear. So we have also a question for Dermot about the new thing that we have in this call, that is a grant that will be provided by the Directorate of Health. So the question maybe is for Gideon. The question is which are the hospitals that are allowed?
The hospitals to participate in the funding, they need to be eligible. So need to be in Luxembourg and need to be eligible for funding. So they also need the accreditation.
Yeah. So question clear. I think we have to check the eligible company on the Ministry of Health side of view. Questions from Bernd on. It's not a question. It's so a comment, but maybe the funding is very interesting. So thank you, Bernd. Questions. Clinical validation, is that a mandatory? So it's a question for Anne or Carole, maybe. Anne, you want to make it?
Yes, sure. Yeah, from my understanding, the goal of this joint call is to validate and at least to evaluate an existing technology. So yes, for me, the clinical validation is mandatory in the project. But maybe Carole, you want to add something?
Yeah, I mean, I think the question of is validation necessary depends on what your project is, your product is. From a regulatory perspective, in health tech, pretty much everything that we can think of, the answer to that question is yes. Now, I have done some clinical validation, and do I need to repeat it in order to do the next thing? Then it depends on your project specifically. in this call, we have expanded it towards the later stage developments of health tech devices too. So you could imagine the project where you have a health tech device that is already clinically validated to be on the market, but does not have the data in order to prove its economic and its societal impact. There you could do a study or a data analysis based on existing data to prove a certain economic impact if you have the right kind of secondary data sets. I think if you have a specific use case where you want to do is discuss it with the colleague of Lux Innovation and see how it fits into the funding scheme. In principle, I can imagine use cases where you do only data analysis to get the economic impact, but to be shown what the ecosystem can come up with.
Yeah, maybe a question that is linked to that. So a question for Andrea, maybe, even if the question is for companies, but are the companies already funded at the first joint call can participate to that call? With the same device, same solution, or different one? Andrea, do you?
You want me to take it on the company side? Well, I think this
Yeah.
is maybe a question to Ministry of Economy who funds the company. From
Yeah.
our side, we don't fund them. So, this is a question also that can relate to the public institutions, of course, for us, the public institution can apply again.
Okay.
The ones that applied last time. Obviously, they should evolve because the world has changed and evolved. And if it's a resubmission, if this is a question of resubmission, then yes. For the company side, I don't know exactly what the requirements are on the ministry side.
Mm-hmm.
Okay, the ministry side, Carol?
Maybe if I can compliment, if it's a project that is now just ramping up the delivery of the Joint Call HealthTech 1 project, I would be surprised that a company has the capacity, bandwidth, etc., to now launch a second project, especially if it's a startup. Company that has a new device, then I think there's no that is of adequate size, that it's credible. There can be 2 development teams. We can have a look at the project. There's no a priori exclusion. Just a question of can you credibly do 2 projects justice and be competitive enough to win the award in a competitive call, and is that really where you should be investing your time? Certainly, if you have an idea, discuss it with Lux Innovation, and we will give you a specific advice rather than generic advice.
Maybe if we are talking about the same device, of course, it makes sense as we have 3 different steps. Is also that we can see that the device is improving, and so it's also maybe very relevant. So as you know, it's only the second edition. Let's see what happens next. But for me, it makes for the next editions, it's logic that you apply with your prototype that is moving forwards and going to target the market at the end. So make a lot of sense. We have a very important question about company eligibility, and maybe I will let that one to Max. So it's a question from Jeremy. So Jeremy is asking about what should happen in case that a company in phase 1 appears to not be eligible, but can maybe turn to be then eligible on phase 2. So how can we manage this?
Thank you, first of all, for the question. I guess I think it's a really important question also to address today. So indeed, there, as I said during the slides, companies that would be considered as, for instance, an undertaking difficulty and would thus not be eligible, they would a priori not be eligible for this call unless they can really show that they have initiated some measures to resolve the situation. So as you also asked in the question, what will happen if they would, for instance, become eligible during the second phase of the call? I think it's really based on the judgment of the Ministry of the Economy, who's having the final word on the funding towards the companies. But one thing that's also important to mention is that it's nevertheless also competition. So if some projects that are eligible would make a better impression, let's say, or would have a larger impact then this might, of course, also play into the pre-selection decision for phase 2. But maybe Carol, you want to add something on that?
Yeah, maybe there's one element to highlight that we didn't discuss so far is that all has an overall budget from the we've communicated at the individual project level or in the presentations, but maybe also at an overall level, both on the Ministry of Economy and on the FNR side. We have a budget in mind that will allow us to finance, let's say, 4 projects, 3 projects, depending. That means it is probably not reasonable to 8 or so projects advance to stage 2 in order to be fair on the workload expected from the colleagues that will prepare the full phase 2 proposals, which are fairly substantial pieces of work. So we will probably recommend or tell some of the projects at the end of stage 1 that it's probably not in their interest to continue, not because it's a bad project, not because it couldn't work, but because other people have better projects and they probably will put effort into a process that won't give them a good reward. So that will also be a criteria that we take into consideration, the relative probability that an individual project can succeed at the very end of the procedure, and we'll take that into consideration when we give our decisions who can advance and who cannot.
Tip top, that's very clear. Question in the same direction. In case companies that are less than 3 years old, and so of course it's criteria that we will consider. What kind of co-funding capacity can be taken into consideration? Maybe this one is for Max.
Yes, thank you for the question. So indeed, in the case of startups, the cash flow forecast, so really providing a detailed cash flow forecast will be a key document in this phase 1 already to better understand your co-financing capacity if you are really able to cover the costs that you plan to have during the project. And it's, of course, if you have some supporting documentation, if you're already in discussions with investors, for instance, you have some term sheets or letters of intent, that can always be very helpful. But it's in the end, I think it's even written in the question, it will be a case-by-case analysis of each company's co-funding capacity and if that one is also aligned with the project costs in the end.
Excellent. I got one. I don't know who will take this one because every one of you, I think, can answer. So the question is that, of course, sometimes is enough for a project to show only evidence on the safety and performance, but not yet on clinical impact because of time saving. So maybe, I don't know, who want to take that one? No one?
I can answer that if you want. What I understand from the question is that if a project only targets the step 1 of the 3 milestone, is it a project that is eligible? So yes, for me, you can reach one of the 3 steps. It's fine. So the first step being the safety and the performance of the technology, for me it's eligible. Yeah. It can fit. Of course, we need to know a bit more about the details, but based on this question, it's a yes for me.
Okay, this one we have taken already. Do you see any questions that were not taken? On my side, I think everything was covered, but maybe I'm wrong. So of course, once again, everything was recorded, and so you will have a link in order to access to the record. That also will be on the platform, so you will be able to find the link into the platform. And of course, you also have probably received the dates for the next webinars where we'll go more deep in some details about how this call is working. I would like really, in case there are no more questions, to thank the speakers that we have had today. That was very clear. Thank you very much. Even me, I think I have understood a few things about the call. But maybe I also want to thank the audience and the people who were listening to us. I think that it's once again very important that everyone knows about the rules of this PPP call we work, and happy to discuss this in more details in the coming months. It's a long-term thing. So as you have seen on the roadmap, it's not something for tomorrow. It's something that you have to prepare to align with your potential partners. And we have seen on the previous edition that it's not a tricky thing. But of course, I think it's really a very useful tool in case that you want your device, your prototypes, your digital tools forward to the market. So I don't see more questions. So I think we are done, except if the speakers have something to add. No, yes, Carol, Andrea, no, I think it's done. Everything is covered. Okay, so thank you very much once again, and I was really pleased to hear all of you and to have all the people listening to this call. Do not hesitate to contact us in case there is something that is really unclear. Bye bye. See you soon.
Bye.
Thanks. Bye.
Bye. Thanks.